I would just tell parents, don't always keep seeking answers.
Wow.
Right? Like, I truly think, I don't care where a kid's at, I don't think they ever have to stay stuck. I think there's always some level of, you're not going to change the gene code, like talking about KCNA2. But I think there's always room for adaptability.
Hi, everybody, and welcome to the KCNA2 and Other Rare Epilepsy Podcast. I'm Nancy Massara. I'll be your host today, and we have a very special guest today for our listening audience and for those who can see the video. And today I'd like to introduce Dr. Nate DeJong. He is a neurological chiropractor, and he does neurologic focused chiropractic care for many of our kids and many people that are dealing with different ailments and different types of motor difficulties and some neurological difficulties. He's all the way from Sioux Falls, South Dakota. So welcome, Nate, to the KCNA2 podcast.
Well, thank you, Nancy. I'm very excited to be here, and hopefully God can use this conversation to positively impact whoever listens.
Right. And we already know some people who have had a positive experience in your office. So that's what, that's why we asked you to be on our podcast. So thank you so much for being here.
Yeah. And I'm honored. So excited to chat with you today.
Good. So tell us a little bit about your practice. I know it's called Highest Health Chiropractic Care. How did you get started and what do you guys really do?
We're almost a decade in. So 9 years into practice, opened up a long time ago, way back in 2016. That was my wife and I and a team member. And it's just grown and exploded from there. And we've been neurologically focused the whole time. And I guess we have just continued to refine what that looks like as we learn, as we gain a deeper understanding of the nervous system, as you gain experience, right? Like you implement new things clinically as you care for people. And it's just evolved and evolved and evolved over that almost 10-year time frame. So we see whole families. Co-regulation is a real thing, right? Everybody in a family unit, their nervous systems are connected together. So our goal is to see the whole family unit. But I like a little phrase we have is we're all needs peds. So it doesn't matter how challenging it is, how delayed the kiddo is, how stuck they are neurologically, whatever they have going on. We can talk about some factors that might limit progress later, but there's room to create adaptability within any kiddo's nervous system.
Wow.
So that's where the kind of all needs peds comes in. It doesn't matter their level of need that they have. We're going to be able to care for them and work towards optimize whatever optimal looks like for them.
One of the things that people, though, think when they think of a chiropractor, they think of like, oh, my back hurts or my neck hurts or, and then they're like, oh, what should I do? I can't like just be taking Tylenol and Advil my whole life. So they go to chiropractic care. Yeah. But it sounds like your kind of chiropractic care is expanded from just my back hurts. How are you different?
Yes, that's a great, I appreciate you bringing that up, right? So pain, it's a very common thing that people think about when you think about chiropractors. It's kind of where the roots of our profession started. It started in pain. It started helping people feel better, and that's good. And there's a beautiful application for that. And that's kind of the largest piece of the pie of our profession, I would say, and helping people with pain naturally is amazing. And that's good. I'm glad we can do that. I would say that's like the tip of the iceberg. Right. So if you think about utilizing chiropractic care for that, neurologically focused chiropractic care just to get rid of pain is just like only ever brush your teeth or go to the dentist when you have a horrible toothache. Pain and nociception is such a small part of what the nervous system's truly doing that to use neurologically based care that way is like you're only getting the tip of the iceberg, and there's a lot going on neurologically underneath the surface. You might not experience any symptoms at all. And if you can optimize that, now you're really setting somebody up to heal and function at their best, not just feel a little bit better, if that makes sense. So,
It does. It sounds like so you're really, like, looking at the underlying not so much cause of a problem, although it could be, but what needs to function first to either prevent or,
mm,
heal a problem that's already existing. So
exactly.
you're going down to that central and autonomic nervous system, correct?
Bingo. Yep.
So how, like, if some well, I want to ask you about initial assessments, but before we do that, in general,
Mm,
what does the central nervous system do, and what is our autonomic nervous system supposed to do?
yeah. Yeah. Great question. So, there's a cell biologist, Bruce Lipton. He's a teacher at a chiropractic college, and one of his quotes that I use in one of the workshops that we do inside of our clinic is the role of the central nervous system is to perceive the environment and control the response of all other cells in the body. So really the brain and spinal cord is the central nervous system. And we all get taught that the brain controls the body, and that's true. But really the brain is a response center, right? So the output that it gives in terms of control is dependent upon the input that comes into it, right? It doesn't freely choose what it wants to do on its own. So where we fit into that picture and why we focus on the central nervous system is essentially, to very simplistically, if you change the input into the system, now you can help improve the output, right? How it goes and then controls the rest of the body. So that's why we stay focused there. And that's the baseline of all of our physiology, right? The nervous system is
Mm.
controlling and coordinating. It's our flight control center. And so if that's disorganized and stressed and stuck in a fight or flight mode, or if it's been, if issues have been there for a long time, the nervous system's very exhausted and depleted, you're gonna have things that just don't function well throughout other parts of the body because that's what's controlling everything. So that's why we focus there, because you can do one thing and have such a diverse array of improvement across all of the patients that we see because the nervous system's so integral to our body's function.
And to many of the functions.
Yeah. Yeah. Like literally everything.
So this is where, like, a parent would have questions because once they
Hmm.
come to you, many parents that come for help, there's so many things that are going wrong. I
Yeah.
mean, they're not coming to you like, well, just a little bit of problems. They're coming to you after the child may be having speech issues, learning issues, sleep issues, and
Yep.
possibly on many other medications. So you can't tell what is a side effect, what is the problem, how do I divide up what's going on? So
Totally.
let's say a parent comes to you with, let's say, a 10, 12-year-old child. I guess it doesn't matter the age, I'm guessing, when I'm asking this. What do you do? What's your initial assessment like? And how do you pick the treatment when it's the central nervous system may be affecting everything?
Yeah. That's a great question, Nancy. Man, I like to say, I think I've said this thousands of times to practice members because they get a lot of questions in the clinic, well, do you think you can help this person with this thing, right? Or I got my cousin's got this going on, or I know this kiddo in somewhere else that's got these huge challenges. Do you think you can help? And the answer is always, I don't know. You got to figure out what's going on. But I just like to say that when health feels real complicated, you know, um, like Western medicine breaks the body out into all of its individual parts and tries to treat everything with all these different modalities, and it just makes it more complicated and more messy. And when somebody's in that place and they've tried a lot of things and maybe it helps for a little bit, but they're just not getting where they want to go, and it feels so overwhelming and complicated, health really isn't that complicated. Focus on the simplest things you can possibly do that are going to drive impact and improve adaptability. And it creates this really solid healing foundation. So when it feels complicated, focus on the simple stuff. That's just something that I just like to share. But in terms of what that process looks like, in terms of evaluating, it's um, probably the most important part, honestly, is taking a really fantastic case history. So you threw out 10, 12 years old. If a kid comes in and they're that old, we're going to ask questions that go all the way back to the prenatal period. So even preconception, what was mom's neurological state when that kiddo was conceived, right? Mom and baby in utero are absolutely connected. Um, so I can think of one of our cases, one of our kiddos in the office is he's a very, very severely developmentally delayed, huge motor milestone issues. I mean, he came in initially, he was 6 years old, never walked, never talked, still wearing a diaper. He basically was at a developmental stage of like a 3-week-old baby, but he was 6. He just couldn't ever neurologically move past where he was at birth. That family had done everything under the sun before they came in. His case history, probably the biggest factor is there was really, really significant prenatal stress on mom. And so he was conceived into a very stressed neurological environment, right? Doing the work that you do, you really apparently know, like, it can be maybe weird to try to connect mental and emotional stress to our physical health. Holy smokes, those things are very connected, right?
Very.
So going and finding, in this case example, it's just that just happened to be the biggest thing prenatally. That was a part of his story. We need to know that because it tells us the duration and the depth of the stress. Like, he was stressed at conception. Sure, we got him at 6 and you could go from birth till 6, but you're still missing part of the story if you don't ask those questions and go all the way back, right? So knowing what the stressors were, when they happened, how significant were they, all the way back to the prenatal period, and then up until that exact moment in time that we're having that conversation with that family, that's super, super important. To kind of go back to your central nervous system question too, because different parts of the nervous system tie to different organ systems, right?
Hmm.
So it's not necessarily super simple where it's like, well, they have a digestion problem, we're going to push on L3 and it's going to change their their large bowel. Like, it doesn't work like that. And to some degree, it is connected in that way, right? So knowing everything, case history, really helpful. Then the second biggest thing is we're going to get good, we call them insight scans. So we run 3 different forms of really detailed technology. So we do heart rate variability, thermography, and then we run EMG, electromyography. So heart rate variability is really good to look at vagus nerve tone, and just overall nervous system adaptability. How can it handle stress or not handle stress? EMG looks for organization of energy and overall, is is the spine and the musculature that's attached to it, is it working way harder, or has it been working hard for a long time and it's really exhausted? So you can actually measure how much is being used to do something simple like maintain posture. And then thermography looks for dysautonomia by detecting heat differences as you run up and down the nervous system from sacrum all the way up to base of the skull right here. So we'll get that scan information and then we'll do a really detailed physical exam. I mean, there's power in getting your hands on kiddos when you know what you're looking for, and you can find tissue tone differences. All kinds of stuff can come from a really good detailed physical exam. And then you put all that together, and then that's what we'll build to build a care plan. That's what we'll use to build a care plan for that kiddo. And everybody's different, right? So like what that looks like is going to be completely tailored to how they go through that detailed process of gathering all that information and what we get from that.
It sounds like you have a child come in, you're told all these symptoms and concerns by the parent, and in
Hmm.
this case, your example, it didn't sound like the child could tell you much,
Right.
right?
Yeah.
So you have to rely on that, and then these 3 intervent or assessment tools that you're talking about, sounds like that's kind of like allowing you to make a map. Like a map of what's
Sure.
going on and where are we gonna go.
Hmm.
So, just curious, so when you do this, do you start with those functions that are the least working the least, or do you strengthen those parts of the functioning abilities that are working the best?
That's a great question. Yeah, like where do you go and what do you start with? So the scans will
Yeah.
drive that the most. Like a simple way to say it is we don't like to guess, we want to test, right? So based on where the physiology is struggling the most, that's where we're going to start. And
Oh,
then you get
okay.
into healing, and that's a journey. There's peaks and there's valleys to a normal natural healing process. And uh, the neuroplasticity process of the nervous system, there's ups and downs to that. So a very important part of the care process is rescanning. So we'll go usually either 12 visits or 4 weeks, whatever comes first, but we like to not ever go longer than a month before we'll run a set of rescans. Because when we provide care over that duration of time, it's making change and we want to get a glimpse of what that looks like. So now we can, if we were starting and just focusing upper cervically, because we got to bring vagus nerve tone up and we got to get things fixed up top, because they're really struggling and they're really depleted and their parasympathetic nervous system needs some love. Well,
Hmm.
that's going to change in a 4 week time frame. And so we'll hit rescans, and then based on what we get rescan wise, then boom, we're going to shift our focus based on what that shows us.
But okay, so let me back up though a second.
Okay.
So you're gonna okay, so you do an evaluation, you see the data that you get from the initial assessments using your tools,
Mhm.
and then you rescan and you see what changed, and you're hoping that changes are strengthening these functions. But
Yep.
you said the changes assessed after the 12 sessions.
Mhm.
Right? What are you
Yep.
doing during those sessions? What are you doing? Are you doing exercises? Are you doing massages? Are you what are you doing?
Yeah, it's a great question. There was more I wanted to say with the last
Oh,
question that you asked
sorry.
me,
Okay, go
and
back
I
and say it
totally
then.
just forgot.
Okay.
Um, so what we start doing and where we start going depends on what we find off the scans. And so how we go in there and adjust is going to be dictated by that too, right? So very, very generically, you can kind of lump nervous systems into two big categories. You can have one that's more stuck in fight or flight. And if you stay stuck that way long enough, eventually you're going to shift to being very exhausted, right? So if a nervous system's really wound up, really fight or flighty, really sympathetic, we're going to approach adjusting that differently than one that's exhausted, right? So if one's wound up, you don't want to wind it up anymore, right? So we might do more of a myofascial approach, gentle, sustained contact adjusting. We're probably going to adjust less. We're going to focus on parasympathetic areas of the nervous system, which tends to be kind of top and bottom, while also, you're baking exam into that, you're baking scans into that. Um, so we're going to approach that very, very differently. And then if you got a kiddo that's come in, they have a very long standing stress, they're super exhausted. Now it's almost like you got to bring the paddles to it, right? The science there is you want to put more proprioceptive input into that nervous system. You need to feed more information up through the central nervous system into the brain to kind of wake things up. So just generically, there's kind of two categories there. And then as somebody progresses through their care journey, the nervous system changes, right? As it's healing and as it's expressing neuroplasticity. So they'll shift back and forth. And so you got to adjust the technique and the approach as you're doing that. Does that make sense?
It makes sense. I guess while you're saying that, I'm thinking s now so many of the people that we see who
Hmm.
have epilepsy or developmental delays, cognitive delays, and motor skills, ataxia, spasticity, they have a right side or left side's more functional than the other. How do you
Mm,
deal with the asymmetry of motor functioning?
yes. Um, Seek to restore balance.
Okay.
That's the simplest way I could say it, right? So, yes, like left-sided information jumps over to the right side of the brain, right-sided information jumps over to the left. So, like, we're thinking about that as you're doing an analysis from one visit to the next. Um, Generically, I would say, like, our approach is we're gonna see a kiddo more often, but do less when we see them.
Oh.
So you can totally overstimulate the nervous system. And the way neuroplasticity works, like you want to put some input into the system, but then you need to give it a window of opportunity to adapt to that input and change, right? So it's better to see kids more often and adjust less.
Do you ever do exercises where if my left side is weak, and I mean
Hmm.
really weak, like I
Hmm.
know people are right-handed or left-handed, like I'm right-handed, I'm probably less functioning than with my left side, but some
Hmm.
people are so off where when they step with their right foot, they're okay balanced. When they step with their left foot, they're ready to fall. So that's a
Hmm.
little more than just a weaker side. Do you ever do exercises where you focus only on that weak side so that it catches up or the neuroplasticity increases on that side of the brain or with that functioning so it balances? Or is that not what you do?
That's not what we do.
Okay.
Um, so we stick very clearly central autonomic nervous system, period. Like
Okay.
that is literally where we live. When you get into motor function and wanting to maybe throw therapy, movement based therapy at, because that obviously influences the nervous system, right? Because a
Mhm.
lot of what's coming into the nervous system is proprioceptive information coming from the peripheral nervous system. We're going to send that over to people that are really, really good at that because that's a whole different
Right.
ball game, right? So,
But
like,
that would be good if, like, you can work with then the OTs and
for sure.
PTs by giving them well, I guess I should phrase this as a question. How do you then take this information that you gain and send it over and communicate with the OTs and PTs so that they can reinforce that in the more motor physical way?
Yeah, yeah, it's a great question. Like the baseline of our function is autonomic nervous system. So
Okay.
a lot of like, I guess I could use that kiddo that we were talking about earlier just as an example. He had tried all the therapy in the world when they came in. He had
Ah,
literally done it since birth, right? And that those things are amazing, right? Diet, detox, therapy, like counseling, all the things, they're all good, right? And there's time and place and purpose for everything. The thing that's controlling all of that ultimately, right? Our flight control center is our nervous system. So like with him, he was so stuck neurologically. You could throw all the therapy you wanted at it and try to get
oh,
the OT and the PT and get the nervous system to try to receive that sensory input that you're putting through the therapies. And it was just stuck in such a state that it like none of it would actually stick within the nervous system.
how did you unstick it?
So through adjusting,
Oh, really? What
yep.
happened? Like, did
It
he get way better or
want to get a little sciencey?
go ahead.
Okay. So like you unstick the nervous system by feeding the brain healthy information, right? So he was
Okay.
so stuck from a spinal movement perspective. There was very little to no proprioceptive information feeding up from the spine into the basal brain structures. And then that feeds our midbrain, eventually gets up into the frontal cortex, right? So if you just don't have enough or organized enough information coming from a balanced spinal movement perspective, like good luck trying to put in input into that system and getting it to stick when it's just so stuck and so stressed. So we got him, started getting him adjusted, took so much stress off of his nervous system, fed great information up into his brain. Now his brain's like, oh, I got a little bit of adaptability capacity here. Yeah, you can throw some of this therapy at me, and for sure, I'm going to start breaking through on my motor milestones, right? Because now autonomics are healthy, then you can get into more motor development, which comes after that, right? If you think about it like babies, they need to eat, sleep, and poop. That is entirely autonomic nervous system function. So if they're not doing some of those basic functions easily, their autonomics are probably stressed. So if generic, I like to say, like, if I can't get rid of my own waste, I'm not worried about moving. So a lot of what these kids come in with, it's not usually the driver that parents will mention. Like it's probably either behavior or it's something really significant like seizures or epilepsy or some of these other really significant health challenges. And they're like, parents are like, I want that to change because that's the thing that super affects our life, right? Um, but oftentimes there's underlying other issues that are going on with them. They're constipated. They don't digest very well. They don't eat very well. They don't sleep well. And so what we look for when they start is that's what we want, right? I don't want the big, massive change. Well, I do. I mean, we all want the big, massive change in the thing that's really affecting our life, right? But the very first thing that we look for is, are they sleeping better? Are they getting a little bit of movement pattern change, but we're not doing anything with them? Their body's just doing it on its own. Are they digesting better? Are they going to the bathroom? Like those are, we call those soft signs. Those are the things that we want to see change. Because when that does, just like a baby, when they eat, sleep, poop, all of a sudden they're ready to hit their next developmental milestone,
Right.
right? And
Right.
then
No, that's true. Like,
going from there.
so 2 things come to mind. One is when you see somebody who's stuck, the way
Yeah.
you described it, where their brain can't receive the information. You can
Yep.
go to therapy all day and they just can't receive it.
Yep.
That to me reminds me of like, I mean, as a psychologist, I think that some of what looks malfunctioning in many of us is actually your brain trying to survive and protect itself,
Exactly.
you know? So
Yeah.
it sounds like you're making the stress less. I mean, that's maybe on the outside, you can't tell right away that it's working, but when the stress gets lowered, the body needs to protect itself less. So therefore, it's able to say, all right, I'm safe now. I mean, this is
Exactly.
your nervous system talking to somebody.
You just hit the nail on the head. When the spine gets fixated and stuck, that signals nociception. That's a fancy way of saying your brain thinks you're in pain
Right, and
when
it's
things don't.
protecting itself.
Exactly. And then
It's
that's
actually
the
doing the
information
job
that's.
it's supposed to do.
Yes, I wouldn't know if
Oh,
we were going to get this sciencey, but like that's the information that's feeding up then into the basal brain structures, into the amygdala. So you have your fight or flight system
mhm,
constantly being signaled that you're in fight or flight. So that's where you stay stuck, right? And
right.
when you're in that state, it's like you can try to put other forms of input into it all day long. And the nervous system is just more interested in basal fight or flight protection mode. Dr. Bruce, the cell biologist, says you cannot be in growth and protection at the same time.
True.
So when you take the
That's
stress
true.
down and the nervous system becomes ready to receive information, it's shifting from a stressed state, fight or flight state, sympathetic state, over to a restful state, ready to receive information.
Okay. So when somebody comes to your office and they have a list of all these problems,
Hmm.
what needs to be done first is the assessment on where is this stress accumulating. You know,
Yeah,
we're not
there you
going to
go. Yep.
compartmentalize your whole body like they do in other medical interventions, but we're going to look
Right.
at the whole body, starting with the umbrella of the central nervous system.
Bingo. Yep.
Okay. And then we're going to start with something you may not see, and that is lowering the stress so that your brain and central nervous system can receive information to begin with. Because obviously, all of the interventions that you've done prior are not really working.
Hmm.
So let's say you're a child and our family comes to you 12 weeks, 24 weeks. What are some of the things that the parents actually start to notice first? And they say, hey, this may be working.
Hmm. It's usually the soft sign stuff. We tell them to look for it, right? So look for the changes in the sleep pattern, look for the changes in their digestion. Does the constipation go away? You'll get some emotional regulatory improvement tends to happen
Okay.
too. So kids might transition from one environment to another a lot healthier. They start doing better in school. Um, when they throw the fit, they're able to actually reset themselves. Those are the kinds of things that tend to happen first.
Okay. They can receive information better.
Yeah, for the emotional side, it's right. I'm actually in a state where I'm not so locked into fight or flight, and I'm really ready. I'm ready for something to come into this system. I have some adaptability and some capacity for that.
Now, you know, yes, I hear what you're saying, and I think that's true. But
Hmm.
it's sometimes when more information comes in, this is new information. I'm not used to
Totally.
handling this. So
Yeah.
sometimes I think sometimes things either are worse or look worse.
Mm.
How do you handle that? And am I right? I mean, I don't want to put words in your mouth.
Sure.
Do things
Can somebody
sometimes,
symptomatically get worse?
yeah, what
For
happens
sure.
then and what does that mean?
Oh, it depends on what's going on in that scenario in terms of you said, like, what happens then? What does it mean? Well, it depends what type of expression of that phase of healing is occurring, right? We'll modulate the care when that comes up. So maybe sometimes we might even need to increase the frequency. Like we got to adjust more so we can
Oh,
power through this thing, right? Sometimes, the mental and emotional things like we've had it a few times with teenagers where they get started under care and all of a sudden their anxiety just goes through the roof, right? Because the nervous system's like, whoa, it's like you're kind of shaking the hornet's nest a little bit when you start changing the nervous system. And so sometimes it'll just head off like that. So then, okay, we got to change what we're doing. We're going to change how we're doing this. If we were starting and putting more input into the system at the start of that care, and it's like, just threw things up real quick. Okay, we're going to bring it back down. right? And we're going to bring some calm into the system. We might adjust less often and adjust less just to control those responses while the nervous system is building its resiliency to be able to get through that in a healthier expression. So it depends on the circumstances of what's in front, right? But it's just like you move the care around. Maybe we'll do a rescan faster than what was originally built into that care plan. Like we're going to take an action to control it as much as we can, especially if it's a really significant response. Sometimes they're really significant. Most of the time they're very, very, very mild, and we'll just have a conversation with the parents like, this is good. The nervous system's changing. We love it. And they understand how that can work because we've all been through that. It's like when you work out, you get sore, you get worse before you get better. So like we get that principle. It's just when we actually have to live through that, if some sort of symptomatology gets worse, it's not always fun. But as long as they understand that that's a part of the journey and that's normal, we'll power through. If it's really significant, then all right, we're gonna move things around care wise so that can get back within functionality of life.
What I like about that answer is that you actually are working with the family,
Yeah.
like you're
Mm-hmm.
adjusting, you're reassessing, you're saying, I hear you. Let's see what this symptom really looks like. Let's see how bad it really is. Let's see
Mm-hmm.
what we can do about it. This may be a sign of growth.
Mm-hmm.
We're going to let it go and see where it goes. Um, what are some of, okay, wait, before I ask you about that, like, so let's say a child comes to your facility. Do they stay there a year, or is it like 6 months of
Mm.
treatment that we stop a while and then we come back? Because kids are growing,
For sure.
like, so how does the treatment work in terms of chr- chronological age or duration?
Yeah, it's a good question. All of our care plans are different. There's no possible way to
Oh,
like
to know.
cookie cutter doing that, right? So it's all dependent on the case that's in front of us. It could be as short as a couple month care plan as an initial care plan, all the way up to 6 or more months initially, depending on the depth and the duration of the stress, right? It's like if the kiddo's been super stressed for a very long time, that's going to be a journey. So we're probably going to build a care plan that has a longer duration of time behind it. And the frequency is entirely dependent on the case. So it could be, we could see them as high as twice a day, like 2 adjustments all in one day, every single day of the week.
Wow.
That would be like
Wow.
an intensive. And you could go all the way down to maybe 2 or 3 times a week, just
Two
initially.
adjustments a day for how long? Like, what's the
Depends.
longest that
Yeah.
has ever been?
um, like a couple weeks would be the
Wow.
longest that we would do that. And
That's
you're also like, this when you work with patients, you also have to work with the realities of their life,
yes.
so like
But
we
I
fully
also know
understand. I have 5 kids and a busy
I
schedule.
know.
Like I fully understand that getting adjusted twice a day for 2 weeks is like a really significant commitment of time, right? So you also
Right,
have to work with your families and be like, what's realistic for you guys? If you lived across the street and had all the time and the money in the world and all you had to do was come on over and get adjusted, here's what we would love to do with you.
right.
And then hence you enter the conversation of working with your patients and like what works for them. And as close as you can stick to what would be ideal based on the data that you have, you try to do that.
Well, I know you fully understand with 5 kids. You've got me beat, I only have 3. But I also
Sure.
fully understand the commitment that so many of our
Yeah.
families have. I mean, they would sleep overnight at your place to help their children. So,
Yep.
I know families that have done that. I personally done a few things that sound a little kooky myself for a child when you
Sure.
believe that their care is going to help,
Yeah.
so as crazy as it sounds, or like, just plopping that into your schedule, it's doable. And many parents, I think, have done it.
Yeah.
One of the last questions I have, um, is what are some of the limitations to neurologic
Mm.
chiropractic care?
Depends on the case that's in front of us. Um,
Mhm.
like KCNA2, I'm not going to change the genes, right? So like
No,
that potassium channels, she's going to stay wide open and it is what it is. So there's
I know.
limitations there. right? You got to work with what's in front of you. The goal is always to create as much of optimal as you can for that specific kiddo. There are three big things that we do try to keep an eye on. So, like, just a hypothetical example, let's say a kiddo's starting into a 3-month care plan, right? And we're hitting a couple rescan points and we're like, wow, this really looks stuck. Our radar is going to go off and be like, could there be some other circumstance happening within their system that's holding that nervous system back from being able to release? And there's three big ones that tend to be fairly common. There's obviously more than three, but three big ones. Mold exposure. So if you think about that, like if environmentally they're constantly being bathed in some sort of stressor, there's no way we can overcome that with, even if we saw them every single day, right? Our adjustments don't take that long, but if we see you for 5 or 10 minutes once a day and you go spend the rest of your time bathing in this really stressful, toxic environment, if you just use mold as an example, it can be hard to overcome that,
Are
right?
you also like, okay, so mold would be a stressor. I get that. But also,
Mhm.
is another type of toxic stressor you're referring to an emotional stressor too?
That's number two.
Oh, shoot.
Yeah,
Okay,
that's
keep
number
going
two,
then.
right?
I'm
So
not going to interrupt.
mold exposure is a very stressful, very, very, very stressful environmental thing for the nervous system. Next one is
Okay.
mental and emotional stress. So if that family or that kiddo has been through something really big, maybe there's past trauma, but it's just hanging out in everybody's nervous system, they could be stuck. Yeah,
Okay.
they could be stuck. So like those are the two really big ones.
Was there one more?
Yeah. Trying to think. Oh, yes. Dental infections. My wife
Oh,
and I have been
okay.
talking about this a lot lately, actually. Yeah, ongoing chronic dental infections, just constantly igniting the immune system over and over and over again. And that can usually lead to airway stuff, and then it can start to affect sleep. So you're really disrupting baseline physiology chronically. If there's chronic ongoing gum, dental, airway issues, that can be a big one too, right? You don't sleep well, everything goes haywire, right? So if that's fueling that, that's happening 24/7. We see them for 5 or 10 minutes, maybe once a day. The scale just stays stuck, right? So their nervous system might stay stuck. So those are three big ones.
That's good to know though, because even though that provides a limit to what you can do in your office, the
Mhm.
information that, hey, mom or dad or whoever the caregiver is, one of these three things is going on. We think it's this. And to know what that chronic stressor is that's keeping somebody stuck is
Mhm.
sometimes the first step in solving it.
Absolutely. That's our
So
goal.
that's
Our
great information.
like that's a doctor means teacher. So like our goal is to just be a guide,
Yeah.
deliver information to them, and like just use our experience to just say what is the thing that might move the needle for this kid the most. A lot of the time it's like, well, our autonomic nervous system is so baseline to everything else being able to function, right? It's like if you take stress off of that, that's probably the most impactful thing you could do, at least initially. But then if there's other parts to that story, there's really significant motor delay. All right, well, then you got to get the OT and the PT involved, and they need to do their thing, right? Once the nervous system's ready. And then if there's gut issues, it's like, all right, get those folks in the case. And then if we got to work through mental and emotional stressors, then all right, you're getting those folks into the case, right? So it's like most of the time it's just a sequence. All the things are good, but it's our job to help like ask great questions to be able to discern at what point of their healing journey do other things need to enter into the picture once their nervous system's not so stressed. And then if their nervous system is staying stuck, even though we're trying to unstuck it, that's not very good. Even though we're trying to get it reorganized and take the stress off of it, then okay, what other big factor might be happening in here that we maybe missed, or and they need to go address that, and then let's come back and then we'll start working on the nervous system again. So
It's funny because as you are talking, you remind me of why I wanted you to be on our podcast.
mm,
And the feedback we get from parents who have actually been in your office with their children and with themselves is that you are thorough and you
mm,
are collaborative. And those
Mhm.
are very important things that parents respect and they seek out. Like, I don't want to find somebody that treats my child in isolation. I've been working
Yeah.
with all these professionals all this time. I need someone to pull it together. And it sounds like you really do that. One of the things I'd like to ask you is what would you like parents to know, like who do not understand neurologic chiropractic care, neurologic focused
Hmm.
chiropractic care? What's one thing you'd tell parents or just you'd like them to know about it?
I would just tell parents, don't always keep seeking answers,
Wow.
right? Like, I truly think, I don't care where a kid's at, I don't think they ever have to stay stuck. I think there's always some level of, um, you're not going to change the gene code, like talking about KCNA2. But I think there's always room for adaptability, right? And being able to help a kid just get to a state where they truly can thrive as the way that God designed them, but they're expressing themselves as fully as possible within the way that He designed them. Chase that and like always hold hope for that, if that makes sense. Um, and just give chiropractic care a try. Like in the reality of all the things that go on in healthcare and cost of stuff and time commitments that a person could make for things, it's like it really is. If you just look at it, it's like really a very low cost, pretty low. I mean, I know everybody's in a different place, but it's like you can really give it a really good go for not a crazy investment of time and money for the most part. And it's like, see what that might be able to create for a neurological foundation for them to start to express themselves as optimally as they can.
Do you know if some insurances accept that chiropractic care?
Oh,
Do they pay for it or is that just a big struggle again?
man, when you talk like this conversation that we're having and you're talking about pediatrics and you're talking about kids with varying different neurological challenges, insurance is a real challenge. Insurance and chiropractic is a neck pain and back pain conversation. It's not a neurological disorder dysautonomia conversation, right? It's not recognized. So the way that we do it, so a lot like we're not the only place that does this, right? There's other places across the country, and man, reach out, you guys. It's like this is not about us. It's just reach out and we can help connect you with a great office wherever you're located in any part of the world potentially. Um, if the way that we do it, so I was just saying that to say like the way that we do it, we still accept insurance. But usually we can only bill just like a little bit of it because you can only find so much justification based on the way that the rules of that game are laid out currently, right? And we always want to function within integrity of the way that that's supposed to happen. But man, sometimes that can help create some affordability for families. So like if we can just bill a little bit of it, we'll still try. We've thought about not doing insurance anymore because it would just be a lot simpler, and it just complicates things. And um, it puts seeds of thoughts in parents' heads, and then it can start to dictate the situation. And I just don't like that. Like I don't want it to be about insurance. I want it to be about that kid, right?
Right.
And just
No, I get it.
wanting to help them. And yeah, so
I do know though, I mean, I asked that question, but I will say that for the parents that we know who have received this type of care, they find it very affordable. That it's
yeah,
not like millions of dollars. They didn't have to sell their homes or their cars to afford
right,
it. So it's not like we're talking thousands of dollars.
yeah,
And for what you get, it's, worth it for many people who have done this type of neurological chiropractic care.
yeah.
So I am so thrilled that you came in today to talk with us. I hope that the listening audience followed along. If you would like to find Dr. DeJong, we're gonna
You're gonna
put your
get
link.
that, You're gonna get that, Dion.
Oh, DeJong, there's a J in it. I'm like, wait a minute, that's not right. But
Oh, it's
anyway,
all
we're
good.
gonna provide your link. We're gonna provide
Yep.
where you are and contact information. People can contact you with questions or to schedule an appointment. And I really appreciate you
Yeah.
coming in today. Thank you so much.
Yeah. Thank you so much. And I would say, Dr. Nancy, we've been through trainings. Like we're leaning on experience of people that have been doing this work longer than we have, right? So a great resource would be the Experience Miracles podcast, Dr. Tony Ebel. Tons of great episodes and information about neurologically focused chiropractic here there.
That's
People
good
could
to
go to
know.
PX Docs. So that's pxdocs.com. There you can literally find a directory of doctors that have been through this neurologically focused neurotonal adjusting training that we've gone through, and they're all over the world. So you can find
Wow.
different providers in different places, and you can get a lot more information from the Experience Miracles podcast as well.
Thank you. That's really good information. We'll
Yep.
be sure to include those links in this podcast.
Cool.
So, thank you very much, everybody. Have a great day.
Thank you.